Hi, how are you doing? Welcome to the channel. If this is your first time here, don't forget to subscribe and turn on the notification bell, because we're always bringing content to help you better understand your body, your health, and your well-being. And if you're already part of our community, thank you so much for coming back. Today we're going to talk about something that almost no one talks about, but that could be silently harming your heart health: epicardial fat. Have you ever heard of it? Even people who appear to be at a normal weight can accumulate this dangerous fat around the heart. And the scariest part? It could be increasing your risk of heart attack, high blood pressure, diabetes, and chronic inflammation, all without showing any obvious symptoms. But don't worry. Today you're going to learn what epicardial fat actually is, why it's so dangerous, and what you can start doing right now to protect your heart and your health naturally. Stick with me until the end, because this video might be a real wake-up call, and at the same time a turning point for anyone who wants to live longer and better. Let's get straight to the point. What is epicardial fat? Epicardial fat is a specific type of visceral fat. It builds up between the heart muscle, the myocardium, and the pericardium, which is the membrane that surrounds the heart. In other words, this fat is literally stuck to your heart. Unlike subcutaneous fat, which sits just beneath the skin, epicardial fat is internal, metabolic, and highly active. It's not just an energy reserve. It produces inflammatory substances, interferes with the heart's blood vessels, and even directly affects heart rhythm. So, what makes it so dangerous? Epicardial fat is not just a risk marker. It's an active player in the progression of heart and metabolic diseases. It increases local inflammation, can stiffen the arteries, contributes to plaque buildup in the vessels, and worsens insulin resistance. In short, it's a type of fat that literally feeds inflammation, clogs your arteries, and disrupts your hormonal balance. Even more alarming studies show that epicardial fat is linked to a higher risk of myocardial infarction, which is a heart attack, high blood pressure, atrial fibrillation or irregular heart rhythm, sleep apnea, type 2 diabetes, metabolic syndrome, and coronary artery disease. And you can have this fat even if you're not overweight. That's right, people with a normal BMI can still have dangerous levels of epicardial fat, especially if they have poor eating habits, a sedentary lifestyle, chronic stress, or a genetic predisposition. But how can you know if you have this fat? Unfortunately, epicardial fat can't be detected by simple tests like abdominal ultrasound or bioimpedance. It only shows up through specific imaging tests like cardiac CT scans or MRIs. Still, there are some warning signs. If you have abdominal fat, high blood pressure, high cholesterol, prediabetes, or insulin resistance, your risk of having epicardial fat is also higher. Now here's the good news. Even though it's silent, this fat can be reduced with lifestyle changes. And here comes the practical part. What can you do to naturally reduce epicardial fat? Here are the most effective, science-backed strategies. First, cut refined carbs and sugar. Too much sugar and white flour raise insulin, and chronically high insulin levels promote the accumulation of visceral fat, including epicardial fat. So swap out refined foods for whole foods rich in fiber and with a low glycemic index. Next, adopt an anti-inflammatory diet. Cruciferous vegetables, extra virgin olive oil, omega-3 rich fish like sardines and salmon, berries, and nuts help fight the inflammation triggered by this fat. Another great approach is to practice intermittent fasting. Studies show that fasting, besides improving insulin sensitivity, helps mobilize visceral fat. When done with proper guidance, it can be an excellent tool to reduce epicardial fat. Also, get quality sleep. Poor sleep is directly linked to visceral fat buildup. During deep sleep, your body regulates key metabolic hormones, and that's where, honestly, many people fall short. Exercise regularly, especially aerobic exercises like brisk walking, running, cycling, and swimming. These boost visceral fat oxidation and improve overall metabolism. It's also important to reduce chronic stress. High cortisol, the stress hormone, also contributes to visceral fat accumulation. Meditation, deep breathing, sunlight exposure, and enjoyable activities should really be part of your routine. And finally, include antioxidant foods and supplements. Green tea, turmeric, ginger, and even vitamin D supplementation have shown beneficial effects in reducing inflammation and visceral fat. And remember, this isn't just about looks. It's about a silent risk factor that can be controlled with simple but consistent actions. Let's recap the main points to reduce epicardial fat and protect your heart. First, cut sugar and refined carbs. Next, eat more vegetables, healthy fats, and anti-inflammatory foods. Practice intermittent fasting with proper guidance. Make sure you sleep well every night. Do aerobic exercises regularly. Manage stress with healthy habits. And add antioxidants to your routine. You don't need surgery or heavy medications. What you need is awareness, discipline, and quality information. So, did this video help you? Had you ever heard of epicardial fat before? Leave a comment below if you relate to the warning signs, or if you've already started taking better care of your health and noticed a difference. Let's chat in the comments. And of course, share this video with someone you love. It might be exactly what they needed to rethink a few habits. If you enjoyed the content, give it a like, subscribe to the channel, and turn on the bell so you don't miss the next videos. Thanks so much for watching until the end. Take care and see you next time.